I was born and raised in a multicultural household in a small city called Mexico City, where I was part with a lot of activities around my community and different religions, different people, different everything. Um, Early on, I had the pleasure to serve with the Red Cross and different groups where we were creating outreach and leadership groups for youth. I saw the best parts of Mexico and the worst nightmares that were happening there. Combining this, I pursue, the dream of doing and being an international doctor, and doing healthcare policy. When I talked to my partners regarding this, it was very difficult to translate public health policy to Spanish. It will sound like public health politics. And there was a lot of struggle between having a doctor and a politician at the same time. But when I clarified that this way is the best way to actually create change in a systematic way, they started to comprehend that. After that, I did have the pleasure to be at the World Health Organization. Over there were a lot of opportunities to see what was happening at the country level. The struggles between tobacco companies, alcohol companies, and public health departments in countries, complete countries, and trying to figure out, how to shield our new generations for diseases, and a lot of very hard, critical conversations that I saw and I was part of. Following that, the I saw what was happening with Mexicans abroad, especially our migrant community that was working here in the U.S. And there were not a lot of opportunities for them to be counted, to be, having, a decent conversation about their health, and most importantly, both countries were paying for any medical health problems. Why? Because Mexico was sending people that were young, that were working, creating everything, and they came to the U.S. and they were starting to have like struggles with a lot of things, anxiety, depression, and especially the families in Mexico. A lot of being here, there's a certain feeling of loneliness, of course, and diabetes doesn't care if where you're coming from, you will get it anyway. Then there's a lot of things that were happening here, but there was not enough information to flow towards them, on a matter that it will be culturally efficient and of course in Spanish. Then a lot of these opportunities started to align, and and started to work as on an advisory role for the Mexican Secretaries of Health and Foreign Affairs on our group called Ventanillas de Salud, where one of the most important things that we were bringing were preventive programs, practically, for Mexicans abroad. And from there on, I have been working very close with minorities, communities of color, to make sure that, whatever you're coming from, you have a history, and especially I'm devoting my a lot of my efforts and learnings to the Hispanic community, um, because it's not just the U.S. and Mexico; it's the U.S. and Guatemala, Panama, Colombia, Brazil, uh, and every country that any migrant comes here, they still have a root somewhere else, and understanding that by nationality, it's key for the growth of this country.